Welcome back. As we await the COVID vaccine, testing is critical to let us know who to stay away from, but to also tell us when to stay away from other people if we've had COVID. But testing's not just those swabs you put in your nose. It can also mean antibody testing, a way to determine if you have some immunity to COVID. So to understand more about breakthroughs with antibody testing and what these developments might mean for a successful vaccine, we're joined by COVID-19 testing specialists, Dr. Glenn Hansen at the University of Minnesota, and Dr. Deepak Nath, who runs a COVID testing laboratory. Gentlemen, thank you both for being here.
Good, thanks, Brian.
Starting off the top for folks, can you explain why an antibody test is so important in fighting COVID?
Right. So antibody testing is going to be important because it's going to be a tool we can look at to see where the virus has been and where it's going. Conversations about opening schools are reliant on understanding the prevalence rates. So we encourage people out there, both asymptomatic in the community, as well as people that are feeling exposure to the virus, to ask their healthcare professionals about the role of antibody testing. Local State Department of Health are a vast resource as well. And we encourage the discussions about where antibody testing fits in as another tool in the toolbox for COVID-19.
The key here, Brian, is once a vaccine becomes available, you want to be able to gauge the effectiveness of that vaccine in patients. And you need to have a tool for being able to do that. And an antibody test is exactly the tool you need to be able to go back and do a blood test on a patient to see whether indeed they have developed antibodies in, as a follow-up to a vaccine. And secondarily, to be able to say, how much or what concentration of antibodies you have present. And so the tool for doing that is an antibody test.
What is the actual difference then between the antibody test and those common swab tests that many of us have now gotten in drive-thrus and other places?
So we focused up until now on conversations about swab tests, the molecular tests largely done in hospital laboratories that tell us whether or not the virus is actually in us at the time. We pull out the gene segments to look at it, but antibody tests are another tool in your toolbox, so to speak, for COVID-19. So it's important to know what is an antibody. And antibodies are proteins produced by your body's immune system in response to an infection. So your immune system is a complicated network of cells, tissues, and organs. And when a virus, say COVID-19, enters your system, antibodies are produced to that. And we can run tests in hospital labs now that are blood tests that look for those antibodies produced specifically to COVID-19 to answer the question of whether or not you've been exposed to the virus or have had past infection.
What is it about an antibody test that makes it more effective than some other tests under development?
So when you design tests, there's several components that are important to keep in mind, Brian. First is a test that detects antibodies that actually neutralize the virus. So when you design a test, it's important that you target those specific antibodies in contrast to other ones that the body mounts. Secondarily, you want to have a test that you can rely upon to confidently return a positive result if antibodies are indeed present in blood. Equally, you want the test to come back with a negative result if the antibodies are not present in blood. And those measures for that are sensitivity and specificity. And there are now tests available on the market that have high levels of accuracy, high levels of sensitivity, and also specificity.
Let's focus specifically here on the spike protein and how that factors in.
As I mentioned earlier, Brian, there's antibody responses that are produced to different parts of the virus. The spike protein is, as it suggests, a spike on the outer cell wall of the virus when we look at it under high-powered microscopes. And we've come to learn from both animal models and laboratory models that the spike protein is one of the best targets to raise an antibody response to, but those antibody responses that are raised to spike also are protective antibody responses. They're a type of antibody response that we refer to as neutralizing. And those are the type of antibody responses we want to measure and we want to raise because it provides the best protective effect for the virus. So not surprisingly, many of the vaccine candidates target spike as a target that they're going after in order to raise protective antibodies to that part of the virus.
And how long can we expect people to have immunity to COVID if they have these antibodies?
That, what we learn from other viruses is that if you are exposed to the virus, your immune system is better off than not having been exposed at all. It does provide a little bit of a primer, a protective effect, but in all likelihood, antibody responses will wane over time. When it comes to COVID-19, we don't know that window. Is it 3 months, 6 months? There is suggestive evidence to suggest the answer to that question is yes to both. But there's no question we're continuing to try to look at how long that immunity or that protective response is raised. And it's important that the audience understands that there are now antibody tests that we can look at to see not only are those protective antibody responses raised, but to what level are they raised to, how much of them are in our system. And all of that taken together will continue to inform the question that you asked, which is, can we get immunity to COVID-19?
Critical developments, gentlemen. Thank you. We appreciate the information. Doctors Hansen and Nath joining us tonight.
Thanks for having us, Brian.
And folks, we'll be back after this.